Hello viewers, welcome to Science TV. My name is Ben Barangai and our sign language interpreter is Wanjangere. Let us focus on our news. The Kenya Medical Supplies Authority has pledged to enhance its partnership with devolved governments to improve access to medical services for people with disabilities across the country. The commitment was made during the launch of the 2025 Devolution Conference in Homabay, where the focus is on strengthening the health sector. KEMSA officials stated that authority is actively working to integrate assistive technologies such as wheelchairs, hearing aids, and eyeglasses into its main supply chain system. This will enable the real-time tracking and timely delivery of these critical devices to health facilities in all the 47 counties. Speaking at the conference, KEMSA stakeholders vowed to forge a stronger working relationship with county governments to ensure that essential medicines and medical supplies are distributed efficiently to hospitals nationwide. The initiative is part of KEMSA's broader strategy to support the government's Universal HealthCoverage (UHC) by ensuring equitable access to healthcare for all Kenyans.
I'm the Senior Programs Officer at the Kenya Medical Supplies Authority. The integrated LMIS is a proactive decision support system for national commodity security. So basically, the system ensures, first of all, we understand the commodities that we are releasing in KEMSA and in the health facilities are known where they are, so that we work towards averting stockouts in the health facilities and also towards elimination of wastage.
And moving on, Cabinet Secretary for Interior and National Administration, Kipchumba Murkomen, has expressed concern over the resurgence of criminal gangs in the central Kenya region, warning that the government is prepared to crack down on lawbreakers. Speaking in Nairobi, the CS said that his ministry has received intelligence reports of organized criminal groups regrouping and engaging in illegal activities, particularly in parts of Kiambu, Murang'a, and Kirinyaga counties. He stated that the government would not tolerate any threats to public safety and security, and that decisive action would be taken to dismantle the gangs, and bring members to justice. The CS added that security agencies have been directed to intensify patrols and surveillance in the affected areas and to work closely with local communities to gather information and apprehend suspects. He called on residents to cooperate with the police and to report any suspicious activities.
Drug abuse will become one of the key indicators of their performance. And we will be going for the local community to ensure that we take a very firm decision against the officers at their locality, and disciplinary measures will be instituted against them. Officers also who have stayed in Kiambu for far too long became familiar with the environment, and they have become part and parcel of this business, will be dealt with decisively. And we want also to make sure that there is, I have told the Deputy Inspector General of Police here that they must now institute transfers that are regular to make sure that nobody is getting familiarized with their local environment in a manner that they become compromised in terms of service delivery.
And on to our next news item. Health sector trade unions are protesting against some insurance companies, accusing them of undermining the provision of medical services to the public. Led by the Secretary General of Kenya Medical Practitioners, Pharmacists and Dentists Union, KMPDU, Dr. Devji Atela, the unions claim that certain insurances have implemented policies that compromise patient care and deny members of the public access to essential services. The unions allege that the insurance companies are unnecessarily delaying payments to hospitals, capitation fees to doctors, and have strict limitations on the type of and scope of care covered, leading to a decline in the quality of services. They argue that these actions not only affect the morale of the healthcare workers, but also put the lives of patients at risk. The unions have called on the Ministry of Health and the Insurance Regulatory Authority to intervene and hold the said companies accountable. They have also threatened to boycott working with insurance companies that continue to engage in what they termed as quote-unquote unethical practices.
The available technologies to be also available to our Kenyan citizens and in the future to our East African nationals.
We are having different innovative products that can solve the problems of the peoples of Kenya, whether it is in the CCTV industry, security industry, or connectivity in the internet. We are here for more connections, and we are here to grow and grow together with the Kenyan people. We want to invest here. We want to do.
And moving on, the chairman of the Ethics and Anti-Corruption Commission, EACC, David Oginde, has issued a strong warning to the public servants involved in corruption, stating that the vice has taken deep root in the country. Speaking at a joint forum on cooperation between the EACC and the Leadership and Integrity Committee at Kabete, EACC Chairman David Oginde emphasized that the Commission is stepping up its efforts to combat corruption at all levels of government. He expressed concern that a pervasive nature of corruption undermines public trust and hinders national development. Oginde's remarks come amid increased public scrutiny of government officials and a renewed push by state agencies to hold corrupt individuals accountable. He urged the public to report any instances of corruption to the EACC, assuring them that their information would be treated with confidentiality.
Issues, I think I already mentioned that clearly, that we should desist from enlisting our family members in corrupt deeds. And you gave examples of some of the individuals that we're investigating, in particular Honorable Oparanya and Mwangi wa Iria. At the stage where these investigations were, our role and responsibility was that at the appointment stage, the parliament, that is the vetting authority, would write to us requesting if we have any information on these particular individuals. And our role is to provide the information that we have without passing judgment, because we are not the ones who will declare a person innocent or guilty. But we get the information and we say, on this particular person, we have these cases that we are pursuing, we are investigating, they are at this stage, and that vetting body then makes the decision in light of many other circumstances. So if they decide that this person is okay, can serve the country, it is their role and responsibility. If they take our word seriously and they feel that this person should not serve, that is their role. But ours is to provide that information. We cannot tell Parliament to refuse to appoint a person just on the basis of the information we have, because that determination, as CEO has said, will be made by the courts when that case goes on. And just to let you know that the fact that a person has been appointed into a public office does not kill the case that we have. So those cases are still alive. They have not been withdrawn. They have not been dropped. And at appropriate times, they will still come and follow the individual. So people cannot hide behind politics or behind public appointments to run away from responsibility of the things that they have.
And on to our next news. Senators are now demanding that President William Ruto provide evidence to back his recent claims that some of them are taking bribes when handling impeachment cases against governors. The lawmakers who have expressed their outrage over the president's remarks stated that such blanket accusations tarnish the reputation of the entire Senate. They said that if the president has concrete evidence of bribery,
Article 125 gives us the power to compel the appearance of any person before this committee, any person, including the president who is making allegations of unethical conduct on the part of Parliament. I want to challenge the speakers of the two houses, because they are the ones who chair the Powers and Privileges committees, pursuant to the Parliamentary Powers and Privileges Act. For the president to come and explain who are those people who are demanding bribes, who are those people who are given bribes, because you cannot try Parliament in a kangaroo court when statute already has clear provisions for dealing with unethical conduct on the part of members of National Assembly or members of the Senate. I think we should move away from this lynching, from this kangaroo court mentality, and challenge our speakers that they must convene the necessary committees and listen to evidence from the president and listen to evidence from anybody else who alleges unethical conduct on the part of members of National Assembly.
And moving on, Dr. Richard Lesiampe has officially assumed leadership as the acting Chief Executive Officer of Kenyatta National Hospital. Dr. Lesiampe was formally handed over the instruments of power by the outgoing CEO, Dr. Evanson Kamuri, who has served in the position for 6 years. The transition comes amid a major shakeup in the hospital's leadership following recent security concerns and the tragic murders of 2 patients within the facility. Dr. Lesiampe is tasked with implementing a new strategic vision to restore public confidence and improve governance, security, and administrative systems at the country's largest referral hospital.
New person, he was here some times back and he's coming back. So I will only show you the new corridors we have created recently. But otherwise, the staffs are willing to receive you and they are willing to support you.
Is to come back, not to do anything else, but just to provide the leadership to allow the employees and the staff of Kenyatta National Hospital to unleash their potential, to provide them an amicable and amiable environment.
We don't have much advice for him, we only have expectations. Expectations that we will move closer to the journey. This hospital has a lot of challenges. We have a lot of challenges to get, especially on the issues around budget. That is why issues about revenue are very important as part of the reforms. But even as we engage with our national treasury to look at how best do we sustain the facility, this year alone we had a budget cut of 3 billion. And so, Dr. Lesiampe, as you come in, the in tray is full.
And moving on, the Principal Secretary for the Ministry of Interior and the National Administration, Raymond Omolo, has announced that the government's plans to collaborate with foreign nations in its efforts to combat terrorism. The move, he said, recognizes the transnational nature of the threat. Speaking at a meeting of global security chiefs who are gathering in Nairobi, Omolo stated that the forum's main objective was to discuss strategies and frameworks for preventing terrorists from crossing international borders. The PS emphasized that the coordinated approach is crucial for disrupting terrorist networks and ensuring national security. The meeting brought together heads of security from various countries to share best practices and intelligence, highlighting Kenya's commitment to a global strategy against terrorism. Omolo affirmed that Kenya will leverage these partnerships to enhance its capacity to prevent, detect, and respond to security threats. We will be taking a commercial break. We will be back with a